Thousands of adults in their 50s and 60s have reduced chronic knee pain by more than 60% in just 8 weeks, without injections, surgery, or expensive treatments. These are real outcomes reported from multiple clinical trials in Japan and the United States, where targeted muscle strengthening programs led to significant pain reduction and improved mobility in older adults with knee osteoarthritis. The real breakthrough is not that relief happened, but that it came from strengthening the muscles around the knee instead of just treating the joint itself. This matters deeply because over 30 million adults in the United States experience knee osteoarthritis, with risk rising sharply after age 50. Research from Tokyo and Boston shows that specific strengthening exercises can restore knee stability, reduce inflammation, and rebuild confidence in movement. Many adults over 50 are told knee pain is something they must accept as part of aging or manage with medication alone. But targeted muscle work can stabilize the knee joint and give people back years of comfortable movement, often exceeding what medication can provide on its own. Knee pain is frequently misunderstood. People feel it in the knee, but the root issue often begins in the muscles and joints above and below it. The knee is a hinge joint that depends on the hip and ankle to control where it bends and how much pressure it experiences. When those surrounding muscles weaken with age, the knee suffers the consequences. Common habits like icing, resting, or bracing the knee offer temporary comfort, while the true instability remains. Fear of unpredictable pain leads many seniors to shorten their stride, avoid stairs, and hold their body rigidly, habits that increase joint stress. Reframing the problem removes blame from the body. Aging muscles lose mass and coordination, but that doesn't mean damage is inevitable. It means the strategy must focus on retraining the right muscles at the right time. Once people understand what's really happening and which muscles need attention, the body often responds quickly. The first sign is frequently not less pain, but more confidence in the knee during movement, the brain realizing the joint is supported again. That confidence accelerates healing. These 5 progressive, home-based exercises rebuild that support safely, starting with basic activation and moving toward full functional strength. They require no special equipment and can be done even on sensitive days. Always consult a healthcare provider before starting, especially if pain is severe, and stop if you feel sharp pain. The first exercise is the quad set, a simple isometric movement that reconnects the brain to the quadriceps, the primary stabilizer of the knee. Many seniors experience arthrogenic muscle inhibition, where the brain shuts down the quad to protect a painful knee. This exercise reawakens that connection without moving the joint. Sit or lie with one leg straight out, the other can be bent for comfort. Tighten the front thigh muscle as if trying to push the back of the knee down into the floor or bed. Hold the contraction for 3 to 5 seconds, then fully relax. Repeat for about 10 repetitions, aiming for 2 to 3 sets of 10 throughout the day. Focus on control rather than force. Many notice the muscle twitching or contracting more fully within a few repetitions, improving blood flow and neural connection. This foundational step is safe even on painful days and prepares the knee for more advanced work. Once the quad connection feels solid, the next exercise adds controlled movement, the straight leg raise. Lie or sit with one leg straight. Perform a quad set to lock the knee straight, then keeping the knee locked, slowly lift the entire leg about 12 inches off the floor or bed. Hold for 1 second at the top, then lower slowly. Start with 10 repetitions per leg and progress to 2 to 3 sets of 10, once or twice daily. The key is control, not height. If the knee bends during the lift, return to more quad sets first. Stop if you feel sharp knee pain or excessive lower back arching. The third exercise introduces gentle resistance using a household item, the short arc quad. Place a small rolled towel, foam roller, firm pillow, or blanket under the knee so it's bent about 10 to 15 degrees. Fire the quad to straighten the knee, lifting the lower leg until fully extended, heel off the surface, back of knee staying on the support. Move slowly, 2 seconds up, 2 seconds down. Perform 10 to 15 repetitions per leg for 2 to 3 sets. This isolates the quad in the range where it's often weakest in knee osteoarthritis, building stability exactly where it's needed most. With quad strength established, the fourth exercise balances the leg by targeting the posterior chain, the bridge. Lie on your back with both knees bent and feet flat on the floor, hip width apart, arms at your sides. Squeeze the glutes and hamstrings to lift your hips until your body forms a straight line from shoulders to knees. Hold for 3 seconds at the top, then lower slowly. Do 2 sets of 10 to 15 repetitions, resting about 30 seconds between sets. Focus on squeezing the glutes hard. If you feel it mostly in the lower back, adjust to emphasize the glutes more. Once this feels easy, you can progress to a single leg version by extending one leg straight, but only when the double leg bridge is comfortable. The fifth and final exercise stabilizes the hip from the side to prevent the knee from collapsing inward during walking, turning, or side steps, sideline hip abduction. Lie on your side with the bottom leg bent for support and the top leg straight, head resting on your arm or a pillow. Lift the top leg straight up, keeping it in line with your body and toes pointing forward. Hold briefly at the top, then lower slowly. Perform 10 to 15 repetitions per side for 2 to 3 sets. These outer hip muscles are often severely weak after age 50 and make one of the biggest differences in how the knee feels during daily life. Together, these exercises, quad set, straight leg raise, short arc quad, bridge, and sideline hip abduction, create a complete program that supports the knee from all angles. Start slowly, progress gradually, and listen to your body. Many people notice improved confidence and reduced pain faster than expected, turning knee issues from a mystery into a manageable process that restores strength, stability, and independence.